Today I would like to interview Professor R.C. Saxena, ex-director and head pharmacology in KG's Medical College, Lucknow. And nowadays he's working with MCS, CMS as professor and head in Lucknow. So I would like to ask Dr. R.C. Saxena, what is pharmacokinetics?
You see, today I am going to talk about the pharmacokinetics, and this has been explained very simply with the help of a very simple diagram which have been self-made by Dr. Mona, who is also associate professor here at Lucknow in one of the medical colleges. You see what happens when you are giving a drug to a man, then there is an interaction between the drug as well as the body, and therefore the body has to act on the drug or the drug has to act on the body. And this type of the body-drug interaction includes both the pharmacodynamics as well as the pharmacokinetics. Now, as far as your question is concerned regarding the pharmacokinetics, you see, pharma means the drug and kinesis means the movement of the body. So what happens when we take the drug, it goes from the stomach if you are taking it orally, and then from the portal circulation it goes to the systemic circulation, and from the systemic circulation it is distributed to different compartments of the body, and when the action of the drug is over at the pharmacodynamic side, which I am going to explain a little bit later, it is metabolized in the body and then it is eliminated from the kidney. So what you see there are four things in this process. The drug is absorbed from the intestine, goes into the systemic circulation, and then from the systemic circulation it is distributed to different compartments of the body. And because anything which you are giving it from outside, it's a foreign body, it is not going to be tolerated, and ultimately it has to be eliminated by the body. So what happens, that there is a process of the metabolism of the drug, and this takes place in the liver in order to make it more excretable in the form of the polar compound as well as non-toxic. So these are the two purposes of the metabolism, and finally you see it is eliminated mainly through the kidney with the help of the urine. There are many other sites also from where the drug can be eliminated. So what you have seen that the drug is absorbed, the drug is distributed to different compartments of the body, the drug is metabolized, and finally it is eliminated. So it is absorption, distribution, metabolism, and the elimination. So these are the four things. A stands for absorption, D for distribution, then M for the metabolism, and E for the elimination. So this ADME, or absorption, distribution, metabolism, and the elimination of the drug, collectively called as the pharmacokinetics. That means that pharmacokinetics is a study or a science which deals basically with the absorption of the drug, the distribution of the drug, the metabolism of the drug, as well as with the elimination of the drug from the body. Okay? So I hope you are able to understand what is pharmacokinetics. Now one thing more, that as far as the distribution of the drug is concerned, as you can see in this diagram, the drug is distributed mainly into the systemic circulation, and this I call as D1 compartment. From the D1 compartment it is distributed to different other parts of the body or the organ, and they are called as the D2 or distribution 2 compartment. It has got a value, very great value, in understanding what is the volume of the distribution, which is concerned mainly in the management of the dialysis of the kidney, which I will talk to you at some other time in future. Okay?
Okay. So now I would like to ask you, what is pharmacodynamics?
Now here what happens, that the drug is acting onto the body, which is the pharmacokinetic, and body is taking care of the drug. Now then what happens, that the drug can also act at the body itself. Yeah. This is what body was doing earlier, and now you see the drug is acting on the body. Now the body, as you are aware, that it consists of a large number of the cells. This is a bundle of cells in the body, which are making different organs which are functioning individually. Now cell is also an individual unit, just like the bricks. From the bricks you make a house. Similarly, with the cells you make the whole body, and there are different kinds of the cell. Now this cell contains at its outer side, just at the wall of the a room, similarly it contains a biomembrane. Now biomembrane is a very dynamic membrane. It is a bilipid type of the membrane. If you see pistia in the jalkumbi, I am sure you must be knowing that it is existing in the pond. In the pond, what you see, that you see the trees, the herbs of the pistia, and at the same time if the water is very clear, you can see exact image of the same in the water.
Okay.
Now similarly here also you see the cell consists of the bilipid membrane, and this bilipid membrane contains some of the very important proteinous subjects. I tell you what they are. Among the proteinous subjects, the first one is the receptor. Then you have got the channels. Then you have got the enzymes. Then you have got the pumps. Then you have got the carrier. And these proteinous structures, they are embedded in the wall of the cell, in such a way that it appears that the ornaments are embedded in the jewelry of a beautiful lady. Now what happens when we give the drug? Then these drugs, they combine with any of these 5 proteinous structure. For example, they may combine with the receptor, and this type of the drug interaction with the receptor and the drug and the receptor, it forms a dose response curve. That is what is called as DRC. Now what is the underlying mechanism is also one of the very important things. Therefore the pharmacokinetic means that it is the dose response curve and finding out the underlying mechanism of action. Because if you find the underlying mechanism of action, you can discover new drugs, you can discover the mechanism of action of the drug, and that is the very fundamental aspect as far as the pharmacodynamic is concerned. Now in the pharmacodynamics, I would like to tell you one thing more, and that is
Please tell me about something about the safety of the drugs.
you see what happens when the drug combines with the receptor or any of the 5 proteinous structures. You see, it can produce 2 things. One of the things can be desirable, which is required.
Okay.
For example, if you are giving a hypertensive drug, anti-hypertensive drug, you want that there should be a fall in the blood pressure. Similarly, when you are giving atropine, you want that the pain in the abdomen should be relieved.
Yeah.
But at the same time, what happens that there may be some undesirable effects also. For example, atropine may also produce dryness of the mouth. So that means this is acting at 2 sides. One of the sides is the desirable side, and the other side is the undesirable side.
Okay.
So you see, as far as the margin of safety is concerned, there can be 2 possibilities. The undesirable thing, what is the maximum what an undesirable thing can occur with the drug? It can kill a patient,
Yes.
right?
Yeah.
And that is what is called as the lethal dose.
Okay.
So a dose which kills 50% of the animals is called as the lethal dose.
Okay.
It is also known as the median lethal dose or the MLD.
Okay.
Then there is another thing, that what is the dose which produces the desirable response, and that is what is called as effective dose or the ED50. In 50% of the animal, how much amount the drug is producing a particular response. This is also known as MED or the median effective dose.
Okay.
And in the society what happens? It is always which are bad elements, the gundas and other things. They dominate in the society instead of the simple person. Similar holds true with the drug also. In drug also what happens? That the bad effect, that is the lethal dose, is first. So we keep the LD50 above, and down below we keep the ED50. So a ratio between the lethal dose 50% and the effective dose 50%, or you can say it is a ratio between the MLD, that is the median lethal dose, upon the median effective dose, is called as the margin of safety. Okay?
Okay.
That means if the margin of safety is very large, the drug is safe enough. But if the margin of safety of the drug is very low, then it has to be used very, very carefully. I give you an example. For example, if you give ampicillin, it is one of the antibiotics which is used for many of the infective disorders which are gram positive basically. Nowadays also for the gram negative bacteria as well. You can give 1 gram or you can give 12 gram in cases, for example, in cases of meningitis. The person is not going to be affected badly or the animal is not going to die. But on the other hand, you take another drug, for example, digoxin, which the William Withering discovered from the foxglove. And if you give digoxin, which is a cardioactive drug, that means it is effective on the heart, and even normally you see you give 0.25 milligram, but if the dose is increased to 0.75 or more milligram, then the toxicity in the form of the cardiac and many other toxicities which I will discuss to you a little later will appear in the patient. And therefore it is important that when you are administering a drug, you have to be very, very careful, and you have to know what is the therapeutic index. This ratio is called as the therapeutic index, which reflects the margin of safety when you give a drug to a patient. Okay?
Okay. So, can we understand a little bit with diagram also?
Sure, why not? You see this diagram.
Yeah, please.
This diagram shows that there is a body drug interaction, and I mentioned about the pharmacokinetics and the pharmacodynamics at the top, and the pharmacokinetics is the PK and the pharmacodynamics is the PD. Now PK I have written on the left side above, that is the ADME, that is the absorption, distribution and metabolism of the drug. Now here you can see that this is where the drug is absorbed, and then it goes into the systemic circulation, and this I call it as D1 compartment. And from here the drug is distributed to different organs of the body, and here the distribution is known as the D2 compartment. And from here, because when the drug is not wanted in the body, it is a foreign substance, and therefore it is also called as a xenobiotic. So it goes into the liver, and with the help of the enzymes it gets metabolized into an inactive compound as well as the soluble polar compound, and then finally it comes into the systemic circulation, and then it is eliminated from the kidney. Here I have shown with the, this is just a nephron, a unit of the kidney, you know it very well. Now on the other hand, if you see on this side, you find that how you can form a dose response curve or the DRC and the underlying mechanism. And this is what I have shown here, that as far as the pharmacokinetic concerned, the drug action and the mechanism of undesirable as well as the desirable. So I have mentioned two types of the receptor. One is the desirable receptor and other is the undesirable receptor. Many times what happens, that the desirability and undesirability may be associated with each other. For example, with atropine. With atropine you cannot separate the dryness of the mouth and the abolition of the pain in the abdomen. So here there is a ratio between this, that is the effectivity, and the lethality, and that is what is called as the margin of safety, and that decides whether the drug is safe enough to be administered to the patient or not. And this is what is called as the therapeutic index, as I have told you earlier, right?
Okay.
Now as far as the distribution is concerned, here you can see I have mentioned here that distribution can be into the systemic circulation, and that is what is called as the D1 compartment, and that is the plasma site of distribution. On the other hand, this is the D2 site, and this is distributed into extraplasmic compartment. For example, it may be distributed to the cytoplasm, or it may be distributed into interstitial fluid, and these are the site of the distribution. And this type of the distribution which I am describing is here is very, very easy to understand. The basic principle in the dialysis, and this I will talk to you when I will talk to you about the volume of distribution. And this diagram has been made by me. It was presented at one of the international meetings in Japan in pharmacology, and everybody appreciated, where I was acting as the chairman, and many of the people have copied it in order to make understand the other persons in their faculties and to the student. This I am teaching wherever I am teaching, I have got a book. This is compendium, and this is being used by all students, and it's very easy and simple to understand. I'm sure you must have understood about the drug body interaction in a very simple way, and such a diagram you normally don't get everywhere in the books. Thank you.
Okay, thank you very much.